Hey everybody, it's Michael here again, and today we're going to talk about glucose, insulin, and how it all plays out with diabetes and onset of diabetes. So, are you destined to be a diabetic? We look at the numbers, we can find out. In order to be diagnosed with diabetes, you got to have a fasting glucose of 126 milligrams per deciliter. That's come down from 140 from just a few years ago. There's different reasons why those numbers have come down. What happens in your body if you're already full of glucose and you eat more glucose, you eat more carbs, whatever, your body's trying to dump glucose into these cells that are already full, it takes more insulin to shove the extra glucose into these cells. So basically your insulin levels are going to rise well before your glucose levels. So it just seems logical that we would test our insulin levels to see if we're on the trend of diabetes or not. So you can do fasting insulin tests. You can also do HOMA tests. There's kind of misleading nuances in those tests, and they can be expensive. So the best way that I've discovered to check these levels is to check your triglyceride versus your HDL ratio. So triglycerides divided by HDL, and you should come up with a number close to 1.5. A little bit lower, a little bit higher, it's okay. But when that number starts going higher, that's going to tell you that you actually have insulin resistance long before you're going to get a high glucose reading in your test, just because of what the body's trying to do to protect you from high glucose.